Procedure of doing NST. So ask the female to lie in left lateral position. Okay, left lateral, and you are going to tie a belt around her abdomen. Okay, I'll show you a picture. You are going to tie like this. A belt is tied around her abdomen. Okay, so this belt will be connected to a this CTG machine. Okay, and this belt will be having sensors. Right, now you are going to tell that female that while she is lying down, okay, I'm going to perform this for 20 minutes, and you will tell her that in these 20 minutes she has to concentrate on the fetal movement. The moment she feels fetal movement on this belt, there is a button, okay, which she have to press. Okay, there is a button on this belt which she have to press, and when she will press, a small arrow will appear. Right, so I'm repeating, you're going to tie these belts around her abdomen. Okay, around her abdomen, and you're going to tell her that now she has to lie down for 20 minutes in her left lateral position, and while she is lying down in those 20 minutes, whenever she feels a fetal movement, there is a button which she will have to press, and whenever she will press that button, it will appear in the form of an arrow on the graph. Okay, right, so look over here. Suppose this female was lying down for 20 minutes and she felt a lot of fetal movements. Whenever she felt a fetal movement, she pressed the button, and whenever she will press that button, you will get small arrows appearing at the bottom of the graph like this. See, small arrows are appearing on the bottom of the graph. Okay, now I told you a healthy fetus would show fetal heart rate acceleration whenever fetal movements would happen. Okay, so I have to see that when fetal movements are happening, is the fetal heart rate increasing or not. Okay, so whenever fetal movements are happening at the time of arrow, we have to see is acceleration happening or not. Okay, we have to check if acceleration is happening on the graph or not. Okay, and this increase should be at least more than 15 beats per minute for 15 seconds. Right, so this is what I'm going to look at in the CTG still. Right, now in a period of 20 minutes, if I'm getting in a period of 20 minutes, okay, if I'm getting more than 2 acceleration, okay, more than equal to 2 acceleration, okay, that means NST is reactive. NST is reactive, that means fetus is healthy. Okay, fetus is healthy, and you can send the patient back to her home. Okay, send the patient back to her home. Right, but if you are getting in 20 minutes, you are getting less than 2 acceleration, that means what? It is non-reactive. Okay, first of all, we will not tell her it is non-reactive. If it is coming less than 2, okay, initially we will not tell it is non-reactive. If in first 20 minutes it is coming less than 2 acceleration, I will repeat. Okay, I will repeat the NST for 20 more minutes. Okay, 20 more minutes. So if in total 40 minutes, again if I get less than 2 acceleration, then I will say NST is non-reactive. Okay, not initially, then I will say NST is non-reactive. Okay, and a non-reactive NST should always be followed by a confirmatory test. I've already told in the starting of the chapter, it is always followed by a confirmatory test. And what is confirmatory test? A confirmatory test is a biophysical score, right? So that is why I told you that most important parameter on the NST is fetal heart rate acceleration.